Hello everyone, it's Dr. Cary Yurkiw. Welcome to today's webinar on what is the cracking noise in the low back adjustment. Often patients ask me, what is that noise? Or if they've never been to a chiropractor before, they want to know what the cracking noise is that accompanies a chiropractic adjustment. So we're going to talk about that today. My name is Dr. Cary Yurkiw. I'm a chiropractor here in Kelowna, British Columbia, and I've been a chiropractor for over 25 years now. I've seen over 10,000 patients, and I kind of got a jump start because in the first few years of practice, I did locums, which is taking over for chiropractors when they go on holidays or they're away from their clinic. And I saw thousands of patients early in my career because I went from clinic to clinic and saw a new group of patients every couple weeks. I've done over 100,000 adjustments in my career. The locums that I did were really busy, as well as my own practice for over 20 years was really busy. And so I saw so many people for spine and joint related issues and did adjustments for the neck and the low back and accessory joints like the shoulders and elbows, the knees, the ankles, the TMJ joint, the jaw. So I've done many adjustments over the years as well. Today we want to talk about what causes the noise. So what is that noise? And is that cracking noise good or bad? And should I do this to myself? And when I go to see the chiropractor, what does the chiropractor do? So what causes the noise? Well, the noise could be caused by just moving the joint, something called crepitus. And some patients hear that when they move their neck, they hear like a sand noise or gravel kind of noise in their neck or in their low back, or sometimes their knee pops when they're moving it. And they hear these noises and they're concerned about that. Today, what I want to focus on is something called cavitation. And cavitation occurs when we do a manual adjustment to a joint. Most of the time, when we do the old school adjustments in the clinic, and that's the adjustments done by hand, we hear some pops or cracks, and that is called cavitation. It actually feels good when the adjustment's done, and it is the gas that's forming in between the bones in the capsules, and there's liquid in there and there's some gas, and either the gas is forming or dissolving, and the scientists really haven't pinpointed whether the gas is forming or dissolving yet. So are these gas bubbles being created, or are they actually dissolving and causing that noise? And is it nitrogen gas or is it carbon dioxide? They haven't really identified what type of gas it is yet, but they have some theories on it. And the gas popping is incidental, meaning it doesn't mean you've had a good adjustment or a bad adjustment. If you hear pop or a crack in your knee or you're hearing grinding in your neck, it doesn't necessarily mean anything. It's what accompanies that grinding noise. If you have pain or discomfort, there could be something wrong there. If you have limited range of motion, there could be something wrong. And when we do the adjustments in the clinic, of course, we're doing them for a specific purpose. And we're going to talk about that in a minute. So is the cracking noise good or bad? Well, it's good if it's done by a professional like a chiropractor. It can be a byproduct of a successful adjustment, but it's not exclusive to, it doesn't have to be there with a successful adjustment. And sometimes we use instruments in the clinic or tables to do adjustments and there is no popping noise. When we do an adjustment to the spine by hand, and our goal is to realign the spine, so the alignment of the bone or to restore function, there can be a popping noise. And so that is called cavitation when that happens. The cracking noise is bad if it's done as a bad habit. So sometimes patients crack their knuckles. If they don't need to be adjusted, if there's no misalignment, they shouldn't be cracked. And that can cause laxity of the ligaments. It can set up for a bad habit. And sometimes patients will do this for the neck or the low back. They'll twist it and pop it, and they get some temporary relief because there's some endorphins and enkephalins that are released, but they only last for about 20 minutes. So usually people end up having to crack their back or their neck every 20 minutes just to get some relief. Um, so if this isn't done by a professional, it's bad. And I wouldn't do it to someone else either, because if you're not well trained or if you don't have the education, it's not a good idea. Should you do this yourself? No, because chiropractors go and see chiropractors. When we have misalignments, we need an adjustment, we go to another chiropractor, and that's kind of the proof's in the pudding with that. A very simple thing. Chiropractors go to see chiropractors. We can't do adjustments to ourselves. Loose joints move the most. So when you twist your back and you hear some pops, it's the hypermobile ones, the ones that are moving too much, that are popping, cracking. The tight ones need the most help, and that's where an experienced professional comes in, is identifying which one to adjust and then doing that adjustment in those hard to adjust areas. If you do it yourself or do it to someone else, you could injure a joint, you could sprain a joint, you could do worse, and that could hurt the person. So what does a chiropractor do? We want to find the cause of your condition. So when a patient presents with symptoms and a history, we want to understand where their pain and discomfort, their dysfunction is coming from. We want to correct the cause of the pain and the dysfunction. And we want to give you the best advice to maintain that. So the best lifestyle changes, postural habits, exercises, stretches, those types of um, homework that we give to our patients so that they can better take care of their health. Chiropractors focus on alignment. We focus on posture. We focus on the function of the body. And in particular, we look at the nervous system, which is the brain and spinal cord and all the nerve roots coming out of the spine. We look at the muscles and the tone of the muscles. And we know that from the brain, nerve signals are going to every cell, tissue, and organ. So maintaining that communication, the coordination in the body is very important to us. We want to maximize the body's health, and we want to do that through alignment, posture, and function. If you're interested in future webinars, we have webinars that are posted up on chiropractic and health and wellness, and our webpage is on Eventbrite. So drcaryyurkiw.eventbrite.ca. That's where you can register, see the upcoming events. If you follow us, you'll get notified of any new events coming up, and then you can sign up and get a ticket. Most of these events are free, but there are some paid workshops where we follow up on certain topics and get more in depth with those topics. We are on social media, so we're on Instagram, Facebook, and Twitter, and our handle is at Dr. Cary Yurkiw on those three. We're on YouTube, same handle there, and you could subscribe to our channel. And if you do, you're going to get notified of new videos getting posted, whether they're live webinars like this one, or they're shorter videos that we're doing on tips for patients on health and wellness. We do have a podcast, and the podcast is called Super Healthy. And that podcast is on Android and Apple. So if you do have a device like an iPhone and you have the podcast app, which most people do, you can just type in Super Healthy, and then you'll get notified of any upcoming webinars if you follow our podcast. For appointments, we are accepting new patients. We can get most new patients in within 48 hours. If you go to www.caryyurkiw.com, you'll be able to book an appointment there. You'll be on our landing page. You'll see some of the testimonials on our service, and you'll get a description of where our clinic's located and who I am. And we use Calendly for booking. It's a very simple, easy to use booking site. I'll put a link in the show notes below so you can easily click on that if you want to book an appointment in our clinic in Kelowna. So I want to thank you very much for joining us today. I hope you learned a lot about chiropractic and that popping noise called cavitation and how it's different from crepitus. And I look forward to seeing you guys at the next webinar on social media or in the clinic soon.